Liver cancer detection just got a potential boost. Could this simple CT tweak save lives? If you've ever worried about the accuracy of medical imaging in catching diseases early, you're not alone. Liver cancer is a stealthy foe, and diagnosing it correctly can make all the difference in treatment outcomes. But now, researchers are exploring a new approach, using precontrast low attenuation on CT scans as an additional tool to better spot these dangerous tumors. Intriguing, right? Let's dive into the details of this study and see how it might change the game for radiologists and patients alike. First off, for those new to this, let's break down some basics. CT stands for computed tomography, a type of imaging that uses X-rays to create detailed pictures of the body's insides. LI-RADS, or the Liver Imaging Reporting and Data System, is a standardized way radiologists classify liver lesions, abnormal spots, based on how likely they are to be cancerous. It uses categories like LR3, intermediate risk, LR4, probably cancer, and LR5, definitely cancer. Ancillary features, AFs, are extra clues on scans that help doctors decide if a spot looks suspicious for malignancy. Common AFs on CT include things like iron sparing in a mass, mosaic architecture, or corona enhancement. But the researchers point out that some AFs shine more brightly on MRI than CT, leaving room for improvement. Enter precontrast low attenuation, a feature visible on CT scans before any contrast dye is injected. Picture this: on a CT image, a low attenuation area appears darker than the surrounding liver tissue because it's not blocking as many X-rays. This darkness can signal liver cancer, helping doctors tell it apart from benign conditions. It's like a subtle shadow that might reveal hidden dangers. The team, led by Rohee Park, MD, from Asan Medical Center in Seoul, South Korea, saw potential in this and decided to test it out. Their study involved 194 adults at high risk for liver cancer, all undergoing multi-phase dynamic liver CT scans before surgery or a transplant between January and December 2022. This group yielded 328 hepatic observations, 187 were liver cancers, 57%, 26 were non-liver malignancies, about 8%, and 115 were benign lesions, around 35%. Two expert radiologists reviewed each lesion, first using only standard AFs, then adding precontrast low attenuation to see the difference. The results? Eye-opening. Precontrast low attenuation strongly linked to liver malignancies, with a diagnostic odds ratio of 9.1, that's a fancy way of saying it was highly predictive, statistically significant at p less than 0.001. By incorporating this feature, 20 lesions got upgraded from LR3, intermediate, to LR4, probably cancer, 17 of which were actual cancers, plus 3 dysplastic nodules, precancerous spots. This bumped up the percentage of malignancies in the LR4 category from 64.7% to 72.2%. In simpler terms, it helped flag more risky lesions as needing closer attention. But here's where it gets controversial. The team compared diagnostic performance with and without precontrast low attenuation. Sensitivity, how good the system is at catching real cancers, jumped from 79.9% to 88.6%, p less than 0.001, a significant improvement. Specificity, how well it avoids false positives, stayed mostly steady at 85% versus 82.7%, p equals 0.06, not statistically different. So, this tweak catches more cancers without wildly increasing unnecessary alarms. Could this be a game changer for early detection, or might it lead to overdiagnosis in some cases? Think about it, doctors might biopsy more lesions, but that could also catch more treatable cancers sooner. The debate is on. The researchers suggest precontrast low attenuation could become a new AF in LI-RADS, helping identify high-risk lesions and push them into the LR4 category. Still, they call for more research, especially in patients with various liver diseases who've had treatments like ablation, burning the tumor, or transarterial chemoembolization, delivering chemo directly to the blood vessels feeding the tumor. This would clarify its full potential in guiding real-world clinical decisions. And this is the part most people miss. While this sounds promising, it's not without challenges. What if different CT machines or settings affect how low attenuation appears? Or could it sometimes look like other conditions, leading to confusion? As with any medical advancement, balancing benefits and risks is key. Do you think this should be adopted widely, or do we need more validation first? Share your thoughts in the comments. Do you agree it could revolutionize liver cancer screening, or is there a counterpoint I'm missing? Let's discuss. For the full study, check it out here, https://doi.org/10.1148/radiol.2511598.